Hello, everyone. This is Dr. Mike, and I'm back again. And we're going to look at tip or concept number 11. Now, folks, we got 90 more of these to go. So we're going to get to know one another very well over the next 90 tips and comics or topics, whatever you want to call it. And we put these together because we realize as a fitness professional coming into this medical realm, there's so many nuances and so many different things that go on in the medical realm that you're unaware of. I was talking to one of my colleagues, Dr. Angela Thrasher. She assists with our advanced medical exercise specialist residency. She's a physical therapist. She's a former Air Force officer, as well as now she's also a naturopath. And just how we're oriented as physical therapists or nurses or physicians to the whole healthcare process, when we really step back and look at it, we just say, oh yeah, it is what it is. But when you step back and look at it, it really is a very detailed opera. And I've been to a couple of operas. The first one I went to, I was kind of confused because, you got the orchestra, you got, people coming out and singing, and then they go away, and you got props and all kind of things coming in. It can be confusing until you sit and someone explains to you what's going on in the opera. Now you get it. So I'm not an opera fan, but I can get it when I go to the Met and watch an opera now. I kind of feel like, hey, I understand what's going on. The same thing holds true with healthcare. I know for a lot of you, as fitness professionals, figuring out how all of this stuff works and how did the patient get from the hospital to the nursing home and the surgery and the MRI and the x-ray, it can be daunting. The terminology can be daunting. The anatomy and the physiology can be daunting. The pathology can be daunting. And that's why we put this series together, kind of answer some of your questions that we fielded from other MESs over the last 28 years. So this is number 11. Number 11, what services can a medical exercise professional offer? I know that's one that all of you want to know about. So you can offer services within the MET scope of practice. These services include, so folks, as long as you're within the scope of practice and not outside the scope or infringing on or encroaching on another person's scope, as in a licensed medical professional scope. If you're not a massage therapist, you can't do massage. If you're not a physical therapist, you can offer any physical therapy services such as ultrasound, electric stim, joint mobilization. If you're not a chiropractor, you can't do x-rays or high velocity manipulations. You just can't do it because by law, the law says you can't. But as a medical exercise professional, there's so many things you can do. Now, if you look at our show notes, you'll see there in the show notes that we actually have a image of your scope of practice. So your scope of practice as a medical exercise specialist includes the MET assessment, assessing the client from a medical exercise training standpoint, cardiovascular training, flexibility training, strength training, and taking those three and mixing and matching them so that they now help the client get back to function with work or sports or home-related activities. The next component will be functional conditioning. Balance training falls in there, and there's some specifics with balance training that we need to talk about. We'll talk about those in a later session. Lifestyle education, because folks, as a therapist, I know we tell clients, we give them all the lifestyle education they need, but once they walk out of the clinic, they forget it all. So we do need you to help us reinforce that. Aquatic training, which may be an ongoing thing for clients, as well as stabilization training. So these are some of the things that are within your scope of practice as a medical exercise professional. Dry needling, mobilization, electric stim, massage. If you don't have the license for those are not within your purview. You can't do those. That is against the law, and you can actually be charged criminally in situations like this. And we've seen this happen to fitness professionals around the country. You can offer these services in a one-on-one or group format. The need for small group training will continue to grow. I guarantee it will continue to grow, folks. As more seniors enter MET programs, the need for more affordable programs will increase. Small group training for arthritis, low back pain, hypertension, diabetes, and obesity will increase in utilization. As medical professionals embrace the idea of medical exercise training or MET, they will need medical condition-based small group training programs. They will. Medical conditions based on small group trainings will center on the big six: diabetes, total joint replacements, arthritis, hypertension, low back pain, and obesity. Incorporating lifestyle education into both one-on-one and group training programs is an additional service you may offer. And folks, we push this to our MESs. We actually have a program, our MedFit Group Training program. You go over to medfitgrouptraining.com. We actually sell the presentations that you would use in the lifestyle education component of a program that would include both lifestyle education and exercise. Because folks, I can tell you, the physicians, the therapists, the chiropractors, the physician assistants, the nurse practitioners, they're inundated with osteoarthritis, diabetes, hypertension, total joint replacements, low back pain. They're just inundated, and they need some way of offloading these clients in a safe and effective manner so they can be managed better. What better way than to be managed with exercise along with lifestyle education, along with whatever treatment is being done. Lifestyle education gives the client the ability to better manage their medical condition using exercise. Research shows this produces far greater long-term outcomes. These are just some of the services you can offer. Become creative. Package your services and skills with the thought, how can I help doctors, therapists, and chiropractors and their patients better manage chronic disease utilizing my exercise skills, knowledge, and techniques as a fitness professional? If you start thinking about that, folks, you'll come up with programs that will really help the medical professional, and your fitness skills, your knowledge, if you can align those with the conditions the medical professional is managing, there is a full gamut of clients they'll refer to you, but we have to make sure that we now put everything in a context that will help the medical professional or the medical professional's patient, your client, better navigate and better manage their medical condition. So thanks for watching. We got another tip coming up, tip number 12, and we'll talk about referrals in tip number 12. We'll see you in the next one. Thanks.